I'm Assemblymember Bauer-Kahan, for anyone who's new to our virtual or town halls or didn't come to one of our in-person town halls, which is how we used to do these before COVID, and eventually we'll get back there. But before we get started, I want to thank you all for being here. I know how challenging this last year has been in so many ways, and we lost too many community members to this virus and lost a year of lives of going about our business. Graduations were lost and other wonderful things that we usually get to do, but we are getting there. And part of what we're here to talk about is vaccines, which are our pathway to a complete reopening. So thanks for being here. It's really important that we have this conversation and make sure we get out the best possible information to the community. It's really been a goal throughout this pandemic to provide good, accurate information to the community as things have changed and gone on. And I know we probably have some new questions this week because when we planned this vaccine town hall, things have already changed since then. So always new things to talk about. So thank you for being here and getting the best possible information from the best possible sources. And I'm going to introduce the panelists in a moment, but I of course want to thank them for being here to provide you with that information, because I'm not the expert, I'm just the conduit. So one thing I do want to highlight, we're here to talk about vaccines, but it's always important that we remember that we aren't in the clear yet, that we still have people getting this virus. There are variants in our community and we need to stay vigilant. So we continue, despite the fact that we're reopening in really important ways, we want to remember to continue to wear those masks. They are effective and wonderful and easy. And so please continue your mask wearing habits, and please, be patient and work with us as we get to a place where we can be back together in the ways that we used to love to be in large groups, having, meals around tables in crowded places. We will get there. But in the meantime, I did want to point out that my staff and I are here to support you. And the best way to get in touch is to call or email the office. And for those on the Zoom, I'm sure my staff will pop this in the chat, but our email address is assemblymember.bauer-kahan@assembly.ca.gov. Not easy to remember, but it's online. And the number is 925-328-1515. And so a couple of things that I want to just mention before we get into the meat of why we're here is some of the things that we are working on and that we can help you with. So the EDD continues to be a challenge for Californians who have a right to unemployment claims, and we are here to help with that. So even if you are someone whose unemployment claims have been expired, there is additional federal relief. We might be able to help you with that. Or if you have a claim that you need assistance with, please call our office. We want to be supportive in ensuring you get the resources that you are entitled to. Also, the rental relief programs. So we passed rental relief in January that provided relief to both landlords and tenants. So that program is up and running and you can apply for that relief. And we are happy to help you do that. The other thing is, for any of our small business owners, or if you're talking to a small business owner, there is a new round of small business relief grants coming out, round 6. So be in touch if you're interested or need to apply for that. We can help you get that information as well. Lastly, tax day was moved, as some of you may have realized, but I wanted to make sure everyone was aware. So the extension deadline to file taxes is now May 17th. So just wanted to make sure that was on everyone's radar. We continue to provide virtual outreach events, and they're all available on my website. If you're looking for information, please do so. We've had some great events recently in the Tri-Valley, both I had the opportunity to come down and participate in person at a Stop Anti-Asian Hate rally, which is a really important thing for us to be talking about right now, is the rise in anti-Asian hate and what we as a community can do to stop it. So we did do a bystander intervention training with the Asian Law Caucus, and those are available if you want to get more information about how to be a partner in stopping that hatred. We also have legislative briefings on there and other valuable information for small businesses. We did a town hall with Treasurer Ma on resources for our small business community, which was really great. So stay in touch in all the usual ways: social media, the website, email, telephone. We're here to support you. But now, without further ado, let's get on to the folks who have all the information you're here to hear about. So joining us today is Dr. Nick Moss, the Alameda County Public Health Officer, who can answer questions about the county's vaccination plans, tier guidelines, and current statistics. up-to-the-date information. Thank you, Dr. Moss, for being here. We also have Tracy Lewis Taylor, Chief Operating Officer at Stanford ValleyCare, and Dr. Rahul Parikh, I hope I'm pronouncing your name right, Kaiser's Assistant Physician in Chief for the Diablo service area, about their partnership efforts to vaccinate our community as quickly as possible. And a huge shout out to the partnership in the Tri-Valley that has really been critical to getting our community vaccinated at the fairgrounds. So thank you all for working together on that, because access to those vaccines is so critical. So if you haven't had a chance to already send in your questions for our incredible panelists, we have one more. Let me not forget Lisa Erickson of Alameda County Safe Learning. She's going to speak with us about reopening of child care camps and schools. As all of you may know, I have 3 children myself, and I'm very focused on what is happening in the school and summer camp world. So we'll be talking about that as well as we move from the orange to hopefully the yellow tier and eventually into even the green. There didn't even used to be a green, and now we can see the green in the future. So that's exciting. But if you have questions you didn't get to send in advance, please use the Q&A function that you can find below, and we can try to work those in, and hopefully we'll have time to get to as many of your questions as possible today. So without further ado, Dr. Moss, thanks for all of your work. We have been working together, gosh, it's been a year now, on getting the community through this pandemic, and now getting everyone vaccinated, which has been a real large effort. And you guys have done an incredible job in moving as swiftly as possible while focusing on the really important equity issues that we face with this vaccination effort. So thank you so much for being here. And can you just start by giving us a snapshot of where we are in terms of vaccinations, hospitalizations, illness in the county?
Sure. So first of all, good afternoon, everyone. Thank you so much, Assemblymember Bauer-Kahan, for having me today. Really appreciate this opportunity. Also, thank you for all your work as a champion of health and health-related issues. And I really also am very appreciative of the efforts of the state legislature and really all the elected representatives who've been so supportive of what we've been doing here to try to protect people from COVID in Alameda County. I know it's very different in other parts of the country. So in terms of where we are, we're still in a very good place. We're in the orange tier. Case rates remain very low, not quite at the lowest levels we've ever seen since this started, but quite low. And we still do a lot of testing, which means we're detecting cases that are out there. So, I think that's good. The state as a whole also doing very well, remaining at very low levels. We've seen just a few days of slightly higher rates in parts of the Bay Area, but that even it's been looks more like blips rather than sustained increases. So we'll keep an eye on things, but certainly I think we remain in a favorable place. Of course, across the country there are concerning spring waves in the upper Midwest, the Northeast. Other states are being affected. So I think it's a good sign that COVID is not over. We're not past it. There remains risk, and even as we're opening up, people need to be mindful that, as you mentioned, Assemblymember, there are things that we simply need to keep doing, even as we cautiously open up. And I think face covering is among the most important things there. Our vaccination program is going very well. I'm very pleased with the progress. Just have the latest numbers in front of me. About 56% of the adult population, people over the age of 16 in Alameda County, have received at least some vaccine, and 35% are fully vaccinated. Our older adults were at very high rates of vaccination, over 80% for people 65 and older, and finally now making good progress in the 50 to 64 range as well. Certainly we see increased risk of severe disease the older you get, and we're glad to be catching up slowly with some of those middle-aged groups in case there is a spring wave here. And there certainly have been hiccups, but we are continuing to see a lot of people vaccinated. The healthcare system as a whole is doing a lot of vaccinations, Kaiser certainly, and others. So it's not, it's not just our county effort, but truly a community-wide effort to get people vaccinated. This may come up over the course of the conversation today, but not just, we have to be concerned about a spring wave, although I'm somewhat optimistic now that we should avoid anything too serious. But COVID is not going to go away. We're not going to hit, I think, any kind of magical herd immunity in the coming few months. This virus has shown remarkable persistence, and people who haven't had it and aren't vaccinated are going to continue to be at some risk, especially because other parts of the world are behind us with vaccination, and these variant viruses that emerge pose some added risk. So, it's really important for people to, when they have the opportunity to go out and get vaccinated, that's going to provide important protection at the individual level, help keep people in your life safe who haven't got vaccinated yet. And don't think that, it's just going to go away and eventually it'll subside and other people will get vaccinated and that'll be fine. I really do think people are going to remain at risk even if they're not vaccinated and they haven't had this. So just wanted to leave people with that message.
That's really important. Thank you, Dr. Moss. Yeah, one of the things that obviously is critical is that we work to get everybody who we can vaccinated, because there is risk to individuals until that happens. So let's talk about this week's big news, which is obviously Johnson & Johnson's vaccine being paused voluntarily by the county in the state. And I know it was a recommendation of the CDC, but I don't think you were required to pause it. But you did choose to do so, given that there was, I believe, 6 women that had that blood clot issue that we heard about in the news. So can you tell us a little bit about what this means for your vaccination numbers and what people should do if they were recent recipients of the Johnson & Johnson vaccine?
Yeah, I'll start with that. So if people got Johnson & Johnson recently, in the last 3 weeks or so, if you got it further back in the past, this is less important. But if you got in the last 3 weeks, first of all, the risk is very low that you're going to experience any of this side effect that we've seen. And the 6 reported cases in the United States, 7 million people, just about 7 million people got this vaccine. So that's a tiny number. Even if you just look at women of the age group involved here, 20 to 50, we're still talking about 1.4 million people who got the vaccine. So this is very unlikely to affect anybody, but it is important for people to be aware if they are having very severe headache, very severe abdominal pain, or difficulty breathing that it seems very unusual. Seek medical care. Call your medical provider, or if it's a medical emergency, call 911 or go into the nearest emergency department. I know some people don't have medical providers, but you can still seek emergency medical care. If you have insurance, find out who your doctor is. It's good to know that stuff anyways, on the off chance that you get some symptoms. But this is, I would be very surprised if we see a case of this locally, but it's possible. Part of the reason for the pause is to put the word out to providers so that they can know what to look for and report if they see something. And so, we should learn more in the next week or two if there are more cases of this particular pattern that people are seeing. I want to stress that this is blood clots are the issue, but there's some other unique features of these cases. Blood clots are very common in medicine. We see them all the time in different situations. And so you're going to see some blood clots in the millions of people who get vaccinated. But there's a little bit of a unique pattern here, which is why we're paying close attention to these and waiting to learn more information before we start using that vaccine again.
And so has this hurt your vaccine supply significantly in Alameda County? Or are you fairly steady? I know before the pause, we actually anticipated a significant decrease in Johnson & Johnson supply. So I imagine it didn't hit us as hard as we expected, but I'm just curious.
Yeah, that's exactly right. So we had our Johnson & Johnson supplies were reduced because there had been a factory issue, not totally unrelated to this safety signal that popped up. And so we had already planned to not have very much of that vaccine on hand. We've had to reschedule some visits. I think we've only had to cancel maybe 600 appointments or reschedule 600 appointments. Most of the rest of those scheduled appointments, we were able to swap out one of the other vaccines. It does mean coming back for a second dose, but a lot of, that's most of the vaccine we've had has been these 2-dose vaccines. Overall supply remains limited, pretty flat. We've even had a decrease unrelated to this. This week, we are anticipating, even with this Johnson & Johnson issue, supplies are going to pick up hopefully at the end of the month and into May as production of Moderna and Pfizer pick up. So, there are people who are eligible. It's going to take a while to get a visit in some cases. Please be patient, do your best. We're glad to be able to really have everybody eligible who's over the age of 16 now, and just hang in there. Every week we get more.
And so, Johnson & Johnson is paused now. You mentioned in part that's to get more information and decide, is there a risk here? So I guess this might be a premature question and you can tell me if it is, but for those who are thinking, oh gosh, if it comes online, I'm not going to get a Johnson & Johnson vaccine now, that's scary. What would you say? If it comes back online, is there confidence that it's safe?
Yeah, I mean, it is a little premature. I would love to see more information come in. But if it just stays like this, if it's these 6 cases, I think it's very likely that FDA and CDC's Advisory Committee on Immunization Practices, I think they may say, look, this is very low risk. It's much lower risk than the risk of getting sick and having a bad outcome from COVID, including blood clots and a number of other things. And this can remain an option. They may say, based on the weight of the evidence, that it shouldn't be used in people who appear to be at a little bit higher risk of this outcome. And I do think that's a possibility, but unless we see a much more, a higher number of cases, a more concerning signal, I do think there's going to continue to be a role for Johnson & Johnson. Obviously, everybody's going to need to make a decision about what's best for their own health, but I'm going to feel comfortable recommending it if the data say that this safety signal is quite limited. Really, part of the reason for the pause was to get the word out, to try to get more data, as much as to stop people from getting the vaccine. It's always a complicated decision to sort of stop use of a product. So I don't want to. It's a little early. I don't want to overstate the concerns at this point. I think we have to learn more, but I do think there'll be a role, and I think we're going to do our best to make sure it's going into people for whom it has the benefit that we know it has, and no substantial risk.
Got it. There's a couple questions in here about herd immunity. Several people are curious when you think, based on both natural herd immunity from those that have been infected and vaccination immunity resulting from vaccination, when you think we'll get to herd immunity and how much of the population needs to be vaccinated to get there. Do you have any thoughts on that?
Yeah, you see some numbers floating around out there. It's all been pretty theoretical. Herd immunity, what that really means is so many people in the population are immune that the people who aren't immune because they can't get vaccinated, or they're one of those, handful of people for whom the vaccine, even if you get it, just doesn't work. And we know that happens from the clinical trials, not unusual for vaccines, that they're protected anyways, because they're just not enough COVID can get a foothold here. I don't think that's going to happen anytime soon with COVID for a few reasons. One, we haven't even started vaccinating kids yet, right? There's no approved product for people under the age of 16, which means COVID can circulate in that population. Now, we know kids less likely to get severe disease. Younger kids don't appear to be as likely to pass it on. But nevertheless, that's a big population still at risk for COVID. Also, as I said before, around the world, not everybody's getting vaccinated as quickly as we are here in California. COVID will be circulating, and with travel, globalization, all those things, there's going to be a lot of opportunities to keep introducing COVID into our population. And then, the variants and the fact that the virus is changing a bit over time. This is not unusual, totally new to human beings. Adapt. There's a lot of COVID in the world. It gives it a chance to adapt and try to keep doing what it wants to do, which is infect people, spread from person to person. And so, I think that herd immunity may come, but I think it's probably a longer time horizon than we would like. And just as possible is that COVID becomes more of a seasonal virus that doesn't cause as much severe disease. Most of us have some level of immunity. We see it maybe in winter, you get a mild cold, but it could take us years to get to that sort of equilibrium. And so, I think people need to be prepared for this to take a lot longer than maybe the public discussion of herd immunity has allowed for. That doesn't mean that we're going to be stuck in these restrictions forever. I think it's going to be, a lot of life will come back to normal, maybe in some cases sooner than we might even be comfortable with. But there's going to continue to be some COVID risk, and that's why the best thing people can do is get the vaccine when it's their turn.
Interesting. So you mentioned sort of the reopening, right? In Alameda County's current year, businesses and restaurants are able to return to limited capacity. And, we're starting to do these things we haven't done in a long time. So what should private and business community members keep in mind as they begin to go about in the community? You've mentioned a couple things, right? Which is continue to wear your mask, get your vaccine when it's your turn. Anything else they should keep in mind as they re-enter?
Sure. I mean, for the time being, until this summer, at least, we're going to have these state restrictions in place. So, I think they're very good. Follow those restrictions, in your life. Try to, if you're going out to restaurants, if it looks like they've got everything organized and they're keeping people separated, not over capacity, things like that, and it feels safe to you, that's great. But if it doesn't seem like that, if there's a lot of people gathered indoors, it's maybe too crowded, people have their masks off, I think people pay attention to that. If you get a little bit uncomfortable, it's okay to go somewhere else. I think that's going to be very helpful for people. The general rules that have worked all along are going to continue to work. Limit how many people you gather with. Limit how much time you spend indoors with people with face coverings off, and if you're sick, please stay home. Wash your hands. All of those things are going to continue to keep everyone safe and healthy as we move into this kind of other phase where there are going to be less and less of these legally mandated restrictions.
Yeah, well, I have to say the greatest change in my life was when Dr. Fauci and the CDC said that my kids could hug their grandparents again. So there's been some good changes that have been really positive. So one last question for you, and then we'll move on, but we got this question twice, so I got to ask it. So variants. First of all, I know that we're testing more for variants, so we're aware of what's in our community. My understanding is the vast majority of variants are the California variant, but the Southern California variant, but you can speak to that. And then how effective are these vaccines against these variants that now we know are in our community? Oh, there you are.
Hit the wrong buttons there. So variants. First of all, the variants that we're talking about, the ones that you hear about in the news, the numbers remain pretty small, except for that California variant, West Coast variant that you mentioned, Assemblymember. From the evidence that's available, the vaccines that we have are very effective against these variants. They're particularly, to the extent that we've got information about this, particularly for preventing severe disease, hospitalization, death. And so I think you can still feel very confident in these vaccines with the variants that we're seeing now. I think the concern for people like me is more that there is a possibility of something emerging or becoming more common in the future where we would need some kind of vaccine booster to address that. But where we are right now, these vaccines are great and no reason to not get it because of the variant story in the news. We have a handful of these, what they call variants of concern here in Alameda County and in California. But the big story has still been the West Coast variants, which we had really through the winter surge, as near as we can tell. And now the emerging B.1.1.7 variant, which was the one first described in the United Kingdom. That does seem to be playing a role in some of the spring wave in other parts of the country and in other parts of the world. In Alameda County, we don't have a complete picture. It's still a very small number, but the number is climbing slowly. Statewide, the same is true. I think they sequenced something like 6% of specimens across the state in March, and that B.1.1.7 was up to maybe 10%. So rising, but still a relatively small proportion compared to these other West Coast variants. I don't think it changes anything from our, what I was saying before about what we can do to keep each other safe. But it is important for us to just keep in mind that this is a dynamic thing, this pandemic, and we need to, again, keep doing the things that'll work for the variants and help keep each other safe.
Yeah. Thank you for that. Okay, we can come back to Dr. Moss for more questions if you have them, but first we're gonna move on to our folks from Stanford ValleyCare and Kaiser Health Systems. So Tracy Lewis-Taylor and Dr. Parikh, and some questions for both of you about accessing the vaccine. Are there any specific programs or resources for the in-system patients if they need help getting an appointment due to mobility, need for language access, or lack of access to a computer or car? We get some of those calls in our office with people trying to get help. And so just curious, if somebody's struggling to get an appointment, what's the best way if they have extra needs in both of your systems to get those appointments? Tracy, you want to start?
Sure. Thank you so much. And again, I'll echo Dr. Moss's comments. It's really great to be back here for this panel and this discussion. Really appreciate the opportunity and the time that you and your team are taking to lend a voice to these really important messages. So in terms of access, and I apologize, I want to clarify or correct one thing that you just said, which is our in-system patients. Stanford Health System, Stanford Healthcare ValleyCare, has the opportunity to vaccinate individuals that are affiliated with our system, as well as those that may not be affiliated with the system. So patients and what I'll call non-patients alike, anyone in the community can certainly access our system. And I see Dr. Parikh as well nodding his head, so we'll talk about that. But I think as healthcare providers, we really want to make sure folks can get a vaccine in the location that is most convenient for them. So please don't be dissuaded by going to a provider that is not where your primary care provider is located. So for Stanford Healthcare ValleyCare in particular, we do offer obviously the bulk of our vaccine appointments through our online scheduling portal. And again, I'm going to say a couple links. Happy for your team to put them in the chat. If you go to stanfordhealthcare.org, there is a link directly to our vaccine webpage, which allows someone to access all of the information that I'm going to share. So the first is the ability to schedule online. And then for those that may require additional assistance, those that don't have access to a computer, maybe need language assistance or live resources to ask additional questions, we do have a phone number that is staffed Monday through Friday, 8 a.m. to 5 p.m. That is our Stanford Healthcare call center. That telephone number is 650-498-9000. And multiple languages. I think over 200 languages we're able to service through that portal. The other phone number and resource that I want to call out is that number associated with Stanford Children's Hospital. So for moms and dads who want to ensure that their kids have access to the vaccine, so those 16 to 18, the telephone number 844-365-0724. That is our centralized call center for Stanford Children's Hospital. And again, stanfordhealthcare.org has all of this information linked there. In addition to the services that we provide through the call center with regard to scheduling, we also have a lot of accommodations that can be made within our vaccine clinics. So whether it's Emeryville location, certainly the Fairgrounds locations, as well as those across the Stanford system, we do have robust interpreter services on site, either through the direct conversations with our employees or the availability to connect to interpreter services, including American Sign Language, for those that may need additional assistance.
Tracy, can I ask you, if somebody is feeling concerned about getting the vaccine or has questions, we've seen the hesitancy rate numbers and they're not insignificant. Could they call those numbers and get their questions answered?
They can. We generally refer very specific questions to an individual's healthcare provider, since that's where that direct connection to an individual's maybe clinical condition or tolerance for vaccines lies. But yes, we will certainly give out information, and our team is consistently updating based on what we're hearing from our community. So what we're hearing in terms of questions and concerns that folks have.
Awesome, thank you. And Dr. Preet, can you talk a little bit about the best way for folks who need a little extra help right now to access your system?
Yeah, it's great to be here. Thanks for having us. And I'm just really proud of the efforts of the counties, the health systems, including our own, to do this work. I always say I'm speaking on behalf of not just Kaiser Permanente, but particularly a team of people that has been working since December to really get this vaccine into people's arms. So analogously, I think, to Tracy's comments around access to the vaccine, we have parallel paths from members who are Kaiser Permanente, in Kaiser Permanente, as well as those who are not, because that's our community responsibility to get this vaccine out and into people's arms. Certainly, the access to it happens both via phone, where they can call our appointment and advice center or centers. They can certainly learn about vaccines online. So if they go to kp.org/COVID vaccine, they'll be exposed to a whole lot of content and information about the vaccine, points to address vaccine hesitancy as well. And finally, I think, how to book it online. If it's difficult to book online, get on the phone and we'll help you. So those access points are there in a similar way. The vaccine content is available in multiple languages. As we know, in California, we have in the Bay Area, the two most prominent languages are Spanish and the Chinese languages, Mandarin and Cantonese. So we are offering both what's written and can speak to folks in those languages should they need it. And then of course we've gone as big as we can with giving access to locations, right? The convenience piece. So getting to one of our 4 vaccine sites between Alameda and Contra Costa County, whether it's in Walnut Creek, the Antioch Medical Center, Martinez, or Dublin. And then as of the last couple of weeks, we've been live at Waterworld in a mass vaccination campaign in their parking lot, where we've been able to administer the vaccine in parallel with our county partners in Contra Costa. So the idea that we can really get the vaccine into people's arms and by making access convenient both geographically and then sort of from an understanding and booking standpoint remain important. And then as far as language goes, yeah, the languages are available. I'll just speak, the story from our vaccine operations point of view, which is, you will come to our vaccine centers and you may need language assistance. And we have the technology to roll out essentially at all of our medical centers and all of our vaccine sites, a little iPad on a stand where you can press the button, our staff can press the button and get a language or ASL interpreter by video to speak to the patient and assist. So we want to make those kinds of technologies very accessible and easy for our patients and our staff to use. And so those have been big wins that we've had in our infrastructure and our vaccine operations to help with cultural and language barriers.
Awesome, thank you for that. And then prioritization. So as of yesterday in the state of California, everybody 16 and older is eligible to receive a vaccine. But we know, and we heard from Dr. Moss, countywide statistics, but I assume, your statistics probably align, hopefully, with that of the counties. You know, we haven't vaccinated everybody 50 to 64, but we've opened up vaccines to everybody, which there's a lot of questions about. And we can talk more about that. But are you within your systems prioritizing people who are maybe have underlying health conditions or more vulnerable or older? How is that happening, or is it just a free-for-all? Dr. Preek, you want to go first?
Yeah, so we are now open, as I think we all are, to 16 and up. But let's go back a few months when we were just getting started. We were standing up the you know, history's probably largest mass vaccination campaign, no doubt. And we were all trying to do our part to get the vaccine into people's arms, knowing that the vaccine supply at the time was just getting started off the ground, the whole supply chain, the whole infrastructure, the whole distribution. You know, storing these Pfizer, Moderna vaccines is in itself a unique challenge for hospitals and healthcare systems. So many pieces had to be stood up. And yeah, so we were following the tiered system. And then what we realized is that we really need to, you know, well, just to step back a second, one of the guiding principles of this vaccination effort within Kaiser Permanente was and remains getting the vaccine out equitably. And there's a couple of ways to look at that. So, you know, when you come to one of our vaccine sites or one of our hospitals, you see people, you see healthcare workers, you see physicians that all want to do the right thing. What you don't see is how we were trying to get those patients in. And so we did a number of things. So for example, we used 70 plus years worth of data and, you know, back-end systems to identify patients who were both at clinical risk. You know, they have certain setups that are going to make them more likely to get severe COVID, and then also socioeconomic risk. And so we were able to identify using those systems and do very metered proactive outreach in a way that allowed us to maintain vaccine access that was congruent with our vaccine supply. And it was hard because people really wanted to get the vaccine. They still do, but we were doing our best, and I think everyone was trying their best, and we were able to get through that 75 and over, that 65 and over, and now we're at the 16 and up, where we're open now because the vaccine supply feels abundant. But before then, we were using a really kind of intelligent set of systems to try to make sure we were getting the vaccine into people's arms with the frame of equity in mind. And then I'll just tell a story again from the trenches. You know, our goal, our second guiding principle is, you know, for those of you who like Broadway and American history, not to waste our shot. And we did not want a single dose to go wasted. So out of the 165,000 doses we've given so far, I can say that our team at our medical center here, our Walnut Creek, Antioch, and Dublin centers, we have used 99.88% of that vaccine. And so when we found there were gaps in appointments or there were some glitches in our systems, our teams got on the phone and were reaching out to food and ag workers, to school districts, you know, just making sure that we weren't wasting that vaccine or trying to give it just to anybody. We were really focusing on that point of equity and using it. Yeah, it's really remains at the forefront of our thinking of the disparities. The other disparity is also those folks who can't get into a medical center, right? They don't have a car or they're homebound. And so we've got programs now that are stood up to, one, vaccinated homebound members. We're driving the vaccine out to their house. Patients who are leaving the hospital are eligible to be vaccinated. Our ED patients are on the way to hopefully being vaccinated when they're discharged as well. The barrier there has been the J&J holdup.
Well, thank you for that. I think that's so important. And one of the things I know, Contra Costa opened to 16 plus about a week before Alameda County, and it was, I think, the first county in the state to do it. And there was a little bit of discussion around that, but they had tens of thousands of appointments that week that weren't being filled. And they were sending out, I know I live in Contra Costa, and I got my alert saying, if you haven't been, you know, if you're eligible and please sign up, we have appointments, and they weren't filling them. And part of what I think people need to understand is the effort of both the state, the counties, and our health systems is to get our community vaccinated as quickly as possible. And so that means not letting vaccines sit on the shelves, not letting appointments go unfilled. And so to the credit of both of these counties, when they started to see that slowdown in signups, they continue to open to ensure that our appointments were getting filled and we were getting those vaccines off the shelf. And I think that was, seeing the numbers on the back end, it was, I know both Alameda and Contra Costa were very focused on how do we ensure this vaccine continues to flow as quickly as it comes in, it gets into people's arms, because that's how we save lives and get our community reopened. So, so I know there's been questions around that, but having seen all the data and watched this happen, I know they've done as much as they can to focus very deeply, as Dr. Preek mentioned, on equity, on ensuring those who are most at risk get the vaccine, but also ensuring we get it out as quickly and efficiently as possible. And this effort, I mean, I have to say, I don't think if you would have said to me a year and a half ago that we could coordinate this huge of an effort between the private sector, the public sector, every level of government, I would have doubted it, but we really did. We are doing it and we are getting it out there and people are getting vaccinated, and that's incredible. So if you haven't yet and you are over 16, meaning approved to be vaccinated, you're now eligible. And I think one of what I love that both Tracy and Dr. Parikh said is that every single avenue is open to you. And that is really what we have seen this medical community come together and say, is that we will not close any access points to anybody because we want you to go out and get vaccinated. And so whether that be your local Rite Aid, the health system that's nearby, the county, whoever it is, please sign up and go out and get there. And I know that if you are a Kaiser Permanente member or a Stanford ValleyCare patient, that you can go through your health system. It's a great way to do it. You can also go through the county. You can sign up to go to the fairgrounds. You can call your local Safeway or Rite Aid. So please just access it. Any way that is easy and accessible to you is how we want you to get it. And I really do want to thank our partners in the healthcare systems for being open to that, for saying it's not just for our patients, but it's for our community, and owning their role in that, because it is critical in getting us through this pandemic. And I know they all went into this field because they wanted to save lives and protect our communities. And now is the opportunity to do that. So thank you both. So we are going to go to Lisa. This conversation is so interesting. Our time is just flying, but I want to make sure we get to the questions about schools and camps. And they're reopening. So you can see the smile on May's face.
Me too.
It's obviously really, really wonderful to see our kids getting back to their classrooms and their activities and getting to resume life as they should be enjoying it as children. So given that, can you talk a little bit about what you're hearing from the community and what's going on out there?
Sure. So the questions that come in have obviously changed a lot over the course of the year. I've been working on this response since the beginning of March of last year. I think most recently, a lot of the questions and what people are wondering about is obviously graduations, events, because it's the end of the school year. So we're getting lots of questions around that and supporting schools around that. And I can talk more about that in detail a little later. Also, we've been working with schools a lot around when they do have a positive case, what to do, and kind of answering those questions around quarantine and isolation and, who needs to quarantine and how to support schools in doing that. And then also athletics and extracurriculars. Some of that state guidance can be a little complicated. So we work really closely with our schools and our parks and rec departments to help people understand the sports guidance and recreation guidance. And lastly, I think the screening. So as Dr. Moss was saying, we really want everyone to stay home when they're sick. And this definitely applies to schools and childcare. So working with these sites to make sure they understand the health screening process and that they're supporting families around that and how to just make sure that kids that are sick stay home and stay home for the recommended period of time. So I think those are kind of the big picture questions and topics that come in through our email.
That's really important. And I think that one of the things that I think is so important is that our teachers have stepped up to come back to the classroom and to educate our children as they deserve to be educated. But that also means that we as parents need to be responsible and say, if our kid is sick, we're not going to put anybody at risk. And so this really is a partnership. And I think it's critical that we provide that information because It's only fair, right? We protect
Exactly. Yeah.
And it's funny you say about the guidance, because I was just on a Zoom about a program that my kids might be doing this summer. And they said, well, the cohorts are limited to 14. And I was like, I don't think the cohorts are
No,
still here.
they're
I am
not.
an assembly member. I'm reading the guidance and I was still confused.
It's so
But they're not.
confusing.
They're not, because
Yeah.
they're out of purple. But again, in my own status as a parent, I was watching the confusion around this guidance. So I appreciate that. So if, a lot of these small camp providers, et cetera, need help navigating all of this, right?
Yes.
And so what is the best resource for them?
So there's a Safe Learning email, and I can go ahead and share that in the chat in a minute. So it's safelearning@acgov.org. And that's our email. Email is the best way to get in touch with our team. We have a team of people that help respond to questions. So we get questions from, sports teams, camps, from childcare, from schools, and we spend all day basically answering those questions. A lot of phone conversations sometimes, helping people plan, and answering questions about guidance. Pretty much any question, we'll figure out the answer for. Sometimes we have to go to the state to ask if we don't have the answer, but yes, that email is the best way to reach us.
Yeah.
And I'll put it in the chat right now so everyone has it.
Yeah, that's great. And my office navigates this every day. So to the extent that we can connect you with resources too, if anyone's looking for help understanding the state level guidance right now. And huge credit to Dr. Moss and the county, because we often just ping them with the question and they answer it. So there are great resources out there for figuring this out if you need help. So one of the questions that I think a lot of people are wondering is, look, all the school districts look slightly different. Some are in hybrid, some are going back full time, some camps are cohorting, some are, no longer having limited cohorts. Who makes those decisions? And,
Yeah.
how do we navigate all of that?
Yeah, that's a really good question. And there has been a lot of confusion, I think, around who is making these decisions and how it gets made and just the whole process, basically since the beginning of the pandemic. So the way it works is the state, the CDC obviously has guidance, but the state is mainly, they make the guidance. So we follow the state guidance, and the school districts, given that guidance, then they, take that guidance and they really make the decisions locally within their district around how, what the reopening is going to look like. And it has looked very different across the different, districts. They work with their school boards, they work with labor, and they work with families, right? And the communities all have a very different perspective around coming back to school. But it is a local decision. It's really the school board and the school districts and schools that determine the reopening based on that state guidance. And also at the beginning of the pandemic, the Alameda County Public Health Department was making more kind of guidance specific to our county. And then that's changed over the course of the pandemic as well, because the state, I believe, just has more resources now, and they're just spending more time and resource to develop, really good state guidance. So we've definitely adhered more to that state guidance and aligned with that, which has also been helpful because at the beginning, there was a lot of confusion around all the different agencies and the different guidance. So it's nice that we're aligning with the state. So I think it's just a lot less confusing for people. They just have to follow that one, really the state guidance.
Yeah, no, thank you for that. It has been confusing. We
Mhm.
were trying to make it less confusing, but at the end of the day, we want to just make sure we're protecting our community. There is a question actually in the chat for you, which is, and I have to say that again, there was an exposure at my kid's school and I was notified. So I'm curious about this question. It says that East Bay Times had a story saying schools aren't required to tell parents if there is an exposure in a classroom. Are they or aren't they? Is that
That's interesting. Yeah, no, my understanding is that it's a Cal OSHA requirement actually, and a state requirement that it's AB, gosh, now I'm going to forget the legislation number, AB, it'll come to me. Anyway, it's actually the law that they do need to notify everyone that was on campus when there was a positive case. So you might not have to quarantine, but you should get some sort of email or some sort of notification from your school that there was a positive case on campus. Like I actually just got one yesterday from my kid's high school. So that is expected. They would notify everyone on campus when there's a positive case.
And that was my experience. And we were told that if you were if you were exposed, needing to quarantine, you got a separate notification, which I didn't get. Thankfully.
Exactly.
But yes, but we did get that notification. So hopefully everyone's doing that, because that was awesome.
That's good. That's exactly how it's supposed to work.
Well, thank you for that.
Yes.
So, okay, we have a couple. So, oh, good. We have some time to answer these questions in the chat. Thank you so much, Lisa. I think the work you're doing is so important, because we all want to get our kids socializing safely, and this has been really hard to navigate. So thank you. One question that I really like in here from a couple people is, how do we talk to someone who is hesitating to get vaccinated and help them get over their fears of vaccination? And I don't know if, Dr. Moss or Dr. Preek or Tracy, if you have any advice on that, but it's an interesting question. And I know one that many of us will face in the coming months.
I'll start. Would love to hear Dr. Preek or others' thoughts on this. So I think it's really important for people to realize that that role, friends, neighbors, family members' experience and decisions are very powerful when people are considering these and other health choices. And so just the fact that, if you're a person who knows people who so far haven't chosen to take the vaccine, and you have that in and of itself, just the fact that you do it is very powerful. And I'm confident in the vast majority of cases, you're going to be fine, and that is also powerful. They'll see that, hey, you didn't, grow another head or whatever the concern may be. And so, so I think that's very important. And it's always important also to just, in general, listen, validate people's concerns. That's okay. And if it's helpful, the facts are that the vaccines are very safe, they work great, and they are much better than getting COVID, which is still out there. It's, as I said, it is really not going to go away. And everybody who's not vaccinated and hasn't had it is going to get it. So it's just a question of, like, is it worse to get COVID and run the risk of a hospitalization, maybe exposing other people in your life who are vulnerable, or taking a very safe vaccine? I'd be interested to hear how others approach this.
Yeah, so I'm a pediatrician, so I have this conversation about vaccine hesitancy more often than I like, for better or worse. I would say that what Dr. Moss has said is pretty accurate from a population standpoint. I mean, I think it's a really complicated problem that you have to peel back the layers of onions on the onion in terms of what the cause is. And there are outright vaccine refusers for a lot of reasons that are more challenging, but the vast majority of people are vaccine hesitant, meaning that they may not want to do it at first, but with the appropriate time and conversation and trust building, that they'll do that. Now, the trust comes from both having the information that's accurate and accessible to understand and read. It comes from the individual conversations that a family will have, or folks who aren't health professionals will have with their family, ministers, religious leaders, community leaders, and others. That can really go a long way to help convince people. And they've got studies both here and around the world that have shown that if you bring a vaccine campaign into a community and you're using community leaders and respected community elders to do it, you're going to get people to change their minds. And then for me as a physician, a lot of it comes down to conversations over time. And slowly persuading them. So it's a continuous conversation. Now that also bumps up against, now it hasn't for COVID, but it does for a lot of our childhood vaccines, that the expectation and now the law around vaccinating before kids start kindergarten. So there's a lot of different levers you can pull around vaccine hesitancy. But when we're talking about COVID, it's going to be, I think, really this increasing trust and transparency that we can provide around the safety and efficacy of the vaccine, against what Dr. Moss said, which is it's a lot better than getting COVID. The risks are much lower and than getting COVID. So,
and I just would throw in the word transparent. I totally agree. Transparency is really important for around this. I think the moment people think that we're not being straight with them.
And that's why I think this hesitance, the pause on the J&J is so important. It is not an easy thing to do, to make a public pronouncement that we put something into the public that might be dangerous, but it's the right thing to do to say, look, we recognize it and we're going to look at it and make a decision. That could also flare vaccine hesitancy, but the flip side is that we're being transparent.
So important. So one thing that Dr. Preek just talked about is, with childhood vaccines, right? The rules around going to school when the one has to have vaccines. And I know there's a lot of questions about vaccine passports coming and whether that will be a part of this rollout. And so there's a question of whether there's any talk in Alameda County about vaccine passports. Now, I know many people know that this new state guidance allows for in an indoor venue for more occupancy if the venue is deciding to see if everyone is vaccinated. And so there are ways in which it is being introduced into this question of how many people are allowed in a venue, right? If everybody's vaccinated, then it is safer to have more condensed occupancy. But I don't know if there's any talk of this. So Dr. Moss, locally, are you talking about vaccine passports?
There's a lot of talk, I would say regionally, statewide, nationally. We are not in the process of developing anything specific for Alameda County. I think it raises lots of, at least for us, equity concerns about who's had a chance to get vaccine yet. And so we're really cautious at the level of the local government and public health department to sort of say, this group of people can do something and this group of people. Let me back up. I mean, we're happy to endorse the guidance around, things are a little different if you've been vaccinated or not. But I don't think we're very cautious about our role in terms of the actual passport that might be applied across a whole range of things beyond even maybe what is driven by public health policy. That said, I think standards are really important. What does it actually mean to verify somebody's vaccination? Where do you get accurate data? We don't want people photocopying vaccination cards and all that. That doesn't serve anybody's interest. And so I think that's really important. I know the federal government has talked about that. I'm looking forward to seeing some standards. We'll be following this closely. I'm open to hear arguments for how it might be done, either statewide or nationally. Very hard to do just at the county level.
Yeah, and I know that the state is referring to the federal government on this question as well. Right now, that's what the governor's office has said. And I think it's a hard question to answer, but I think, right now the CDC talks about whether you're inside dining with someone who's been vaccinated is a different question than someone who's unvaccinated. So it continues to be something that one can ask questions about and pay attention to, but I don't think there's anything on the table right now about passports. Okay, Tracy, I have a question for you. So you were incredibly involved in setting up our mass vaccination site at the fairgrounds. And I know that parents like me, whose kids are not eligible yet, but we have those vaccines now in study, and we like to get ready before the vaccines hit the market. Is there any talk about how we will get ready to do pediatric vaccines and how that'll work?
There is talk. I don't have details that are solidified enough for me to share in this particular forum, but certainly as we always like to think about what's next, and so certainly that next cohort of the population is absolutely top of mind for us. And then of course, and I'm sorry, Dr. Moss, I'm going to throw you this question. What's top of mind for us right now is Pfizer's CEO last night, noting that there might be a third booster. And so if that does come to fruition, or even if there is a need to have an annual vaccine similar to the flu vaccine, we want to make sure that we are planning thoughtfully around how to be even more efficient with those particular vaccines, whether it's the third booster, whether it's the next cohort of populations. So we will absolutely be there to meet our community needs. What that looks like, stay tuned.
Yeah, no, that's great. And I know we'll be here to give another town hall when it's time for the kids. So
absolutely.
It's one of my favorite subjects.
Ours too, I think.
I know. There was a question in the chat about whether once we are vaccinated as a community, whether it be Alameda County, the state, or the nation, whether we'll be able to send those vaccines abroad. And I think I read that we already did that with some of our AstraZeneca supply. We sent some of that to Mexico and to Canada. But I think it's a great question. It's not just for our members. We need to get the whole community vaccinated. It can come upon us as a state to step up in the world where we can get through this pandemic. And so I know that hopefully that's something that when we get to the point, although we're not there yet, where we have vaccinated our population, that we can start thinking about those neighbors abroad, because it's really critical. But we're not there yet. And I don't think that will be up to the counties, because the counties just receive their supply from the state, who receives it from the federal government. So it all flows down to the counties, but I imagine that will be made at the federal level. So my last question, and maybe the most fun question we got, which is 2+ weeks after receiving our last vaccine shot, is it safe to go to the newly released Marvel movie? Who wants to take that one? Dr. Ross?
You know, from a public health standpoint, yes, we think this is acceptable. You know, if you're vaccinated, first of all, even for unvaccinated people, movie theaters have been open, and it's a little bit of, you know, how comfortable you are. Virus levels are low right now, and so that should be reassuring. But for vaccinated people, you have that added layer of protection, and I really do think it's okay. You know, it's going to be a different decision for each person. I'm just glad that we're at a place where people can make that choice.
But wear your mask to the movie theater. So thank you all for being here. That's all the time we have today. And we got a lot of great questions answered. I always learn a lot on these forums, and I know all of those attending do as well. So thank you so much for being here, to all of our panelists. And more importantly, thank you for all the work you do every day to keep our community safe, to save lives, to get us back to normal, and to get our community reopened. We are getting there. We see the light at the end of the tunnel, and that is mostly because of the incredible hard work of many of the people on this forum. So thank you all. Thanks for all of our participants for coming. It means you're engaged in getting good information and being our partners in getting our community vaccinated and safe. So thanks everyone. Stay safe, be healthy, and we'll see you soon.